Medical Dialogues, your daily dose of health and medical news. I am Dr. Nandita Mohan, and let's look into the latest developments. Delirium at the ICU is frequently linked with acute renal damage, a new study finds. Acute kidney injury and delirium are the two most prevalent problems in the intensive care unit. There is little known regarding the relationship between the two, as well as the incidence and predictors of delirium in acute kidney injury patients. A new study has found out that ICU delirium is frequently associated with acute kidney damage. Delirium was characterized by examining every patient in the ICU 3 times a day, a part of their regular routine. Researchers discovered a significant prevalence of delirium in individuals with acute renal damage. They discovered that higher the levels of acute kidney injury were independently linked with delirium. Furthermore, greater levels of AKI as well as delirium are independently linked with a longer ICU stay. While the incidence was lower in the stage 1 percentage, it rose in the stage 2 and even in the stage 3 cases. The findings showed that the ICU delirium is frequently linked with acute renal damage. These findings might assist neurologists and even the critical care physicians. They screen patients for those who are more prone to develop ICU delirium and provide early delirium treatments. Live music relaxes and alleviates pain in pediatric patients, a new research suggests. We all know that music can energize people during workout and is a source of calming down during stressful situations. But music doesn't just improve moods in adults. It has been found out that music can have a profound effect on some of the youngest, sickest hospitalized patients. The researchers mentioned that this is the first music therapy study to look at the use of live music with pediatric patients on mechanical ventilation. There is a lot of research supporting recorded music with adults on life support but not on children. 33 patients under the age of 2 were included in the study. All were sedated and were on mechanical ventilation. 17 patients received live music intervention from a board-certified music therapist for 15 minutes, while the other 16 patients, they heard 15-minute recordings of the same lullabies performed by the same music therapist. They found that babies who heard live music had an immediate and significant reduction in heart rate. And 60 minutes after the music had stopped, their heart rates were still lower than they had been to start with. Hence, music can definitely indicate a relaxation effect. Sunscreen that includes zinc oxide loses effectiveness, becomes toxic after 2 hours. Sunscreens are important consumer products that help to reduce the UV exposures, thereby decreasing skin cancer, but we do not know if the use of some sunscreen formulations may have toxicity because of interactions between some ingredients and UV light. A research team from the Oregon State University has found out that sunscreen that includes zinc oxide, a common ingredient, loses much of its effectiveness and becomes toxic after 2 hours of exposure to ultraviolet radiation. The researchers then exposed the mixtures to ultraviolet radiation for 2 hours and used spectroscopy to check their photostability. That is, what did sunlight do to the compounds in the mixtures and their UV protective capabilities. But scientists did see big differences in photostability and phototoxicity when zinc oxide particles were added, either the nanoparticles or even the larger nanoparticles. Also, the zinc oxide induced photodegradation products caused significant increase in the defects. Hence, sunscreen should be used aptly. Improper sleep cycle increases the risk of migraine in children. Sleep disorders are quite common, especially among young children. It is known to affect 25% of children. We know that if a child remains sleep deprived, they tend to develop irritations, they start to throw tantrums, and much more. A recent research has added on that children experiencing sleep disorders often tend to develop migraines at a very young age. The study, published in the Journal of Clinical Medicine, reported that disorders related to sleep are linked to migraines. The results showed that sleep disorders were detected in 72.9%, but only 5% had received a diagnosis. Such patients presented statistically significant higher headache frequency and higher prevalence of migraines. Hence, it was concluded that improving the sleep quality could help to reduce migraine intensity as well as disability. PPIs have been found to decrease the severity of gum disease. Proton pump inhibitors are very commonly prescribed for the management of acid-related gastrointestinal disorders. PPIs, they modulate osteoclast function, reduce the gastric acid secretion, and are associated with the establishment of a more diverse gastrointestinal microbiota. Periodontitis, on the other hand, is characterized by microbiome-associated host-mediated inflammation that results in loss of periodontal attachment. A recent research has highlighted that the use of this heartburn medication is associated with a decreased severity of gum disease. The research found that patients who used proton pump inhibitors, a class of drugs commonly prescribed to treat heartburn, acid reflux, and ulcers, were more likely to have smaller probing depths in the gums. When the gums are healthy, they fit snugly against the teeth. However, in the presence of harmful infectious bacteria, the gap deepens, leading to inflammation, bone loss, and ultimately periodontitis. The researchers analyzed clinical data for more than 1,000 periodontitis patients, either using or not using PPIs. Probing depths were used as an indicator of periodontitis severity. Only 14% of the teeth from patients who used the PPIs had probing depths of 6 mm or more, compared to 24% of the teeth from patients who did not use the medication. And 27% of the teeth from patients using PPIs had more than 5 mm probing depth, compared to 40% who did not use. The researchers therefore theorized that PPI's ability to alter the bone metabolism or the gut microbiome, as well as potentially impact the potential microorganisms, may help lessen the severity of gum disease. That's all we have for you today.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.